the hospital and discuss what has been happening and what's coming up that puts the future of St Helier at risk. And we're here to discuss what we need to do to make sure that it continues to provide all the services we need from the local hospital.
When it comes to where our politicians are coming from in relation to the NHS, I fundamentally believe that there is not, well, there's very few, that in fact are willing to fight for our NHS. I believe they're willing to capitulate to the privatisation that is undermining the whole of the NHS, and don't believe that it can happen unless each and every one of you in this room is willing to go out on the streets and fight for it tooth and nail. As people fighting for what is ours and what needs to be ours and our children and our children and our children's children, because otherwise it will be destroyed. Now, I want to say to you why. Because fundamentally it will be destroyed because the people that are in power do not believe in the National Health Service. They do not believe in it. And I'll quote to you. The collective principle asserts that no society can legitimately call itself civilized if a sick person is denied medical aid because of a lack of means. And that is happening now. We've got those problems now. I believe that we have to take accountability, stand up for our National Health Service, and be, as we are, the people. Take it back into our hands so that we control it, not those in big business.
BSBV, better services, better value, or put simply, botched services, bad value. It's a programme that went for 2.5 years and would have led, almost certainly, to the closure of hospital services. And as many of you know, one of the main possibilities was the closure of accident and emergency, paediatrics and maternity at St Helier. Something like 140,000 A&E attendances. Charlotte Joel, in a meeting describing BSBV, had the temerity to say that one of the fundamental reasons was to cut the budget across the South West London sector by £370 million by 2016-17, 23% of the budget. We are no longer primarily concerned with clinical service, the health of the patient, but with finances, the health of the budget.
No, I won't go into the whole history of the Lewisham campaign, but we took the government to court and won twice at our services. And don't we just get fed up with this now? A&E, maternity services, children's services. Are there going to be any hospitals that have those services left in the country? I just find it astonishing. In Lewisham, Jeremy Hunt told us in Parliament on the advice of Sir Bruce Keogh that 100 lives would be saved every year by closing down these services. And when pressed by the consultants from our hospital, he said, oh well, it's not an exact science. And we're fighting for something that, you know, is really important to us. We don't have private health insurance. We've got to fight for that for our children and grandchildren, our neighbours and our community. I don't think it's any accident that, you know, Lewisham's got 3 Labour MPs and they decided to try out this TSA process on our area because it didn't matter because they've got 3 Labour MPs. They can find one hospital in trouble and go into a hospital disgraceful lying, misuse of data, distortion of facts, all the stuff about, oh, well, we're going to have community-based services, but there's no money for those. All the things about big hospitals going to save you lives, when actually you've got to get to a local hospital if you're elderly, if you've got a child, or if you're disabled. You know, please don't talk about that until you've put the structure in to change things, and I'm afraid they haven't. There was no money allocated for community services by the TSA in Lewisham. All the clinical opinion, the patient opinion, the local opinion, the council opinion was completely ignored. So what was said in Parliament yesterday was a pack of lies, and people that supported it should be totally disgraced.
Two quotes for you. Gandhi said, when the government turns against the people, rebellion is the responsibility. I think the point has come when we are going to have to go out and rebel, quite frankly. And from a campaign who run in the States against that big pipeline going across the country from the tar sands, they said, this campaign is not over. It won't be over until we give up, and we aren't giving up. So I would encourage you to go out and rebel and not give up, because they can't take the NHS away from us if we're fighting for it. Thank you.
Hospital, I'm finding that it's been sold. Cause Lansley's cut the national health and sold it off to private wealth. Today's the day we're gathering for a fight back. Boom time now for companies. The private sector spins are happy.